This video will show you how to get limb occlusion pressure of the lower extremity. So I'm going to have the individual lay in a supine position face up, and I'm going to use a size 4 cuff for the lower extremity. There's also going to be a size 3 for people that are very slender and size 5 for people that are a little bit larger. But size 4 should be able to fit a majority of the population. So what I'm going to start with is getting the cuff on. I'm going to have the individual slightly bend their knee just to make it easier for me to get the cuff on the proximal thigh. So I want to get it up as high as possible. If I can get the top of the cuff just underneath the greater trochanter, which is the bone on the side here, the better off I'll be. And it's okay if it goes over clothes, that's no problem. If someone's wearing pants, it's okay. And you want to unbuckle these, open this up, and then place the cuff over. Important thing here is to make sure the valve doesn't go on the inside of the leg. You can keep this knee bent. The valve doesn't go on the inside of the leg, and the valve stays on the outside or in the front the whole time. So I'm going to wrap this around here, and then I'm going to tension it a tiny bit, and then Michael can relax his leg here, and then I'm going to strap these parts up right there. So now I have my cuff on. The valve is not on the inside, and the individual is laying in a supine position. Next, I get the gauge, and I'm going to plug in the gauge. To do this, I have to first put pressure onto the silver part. This is going to unlock the gauge, so that way I can go into the valve. And I can press this silver button to release. So push this down, and then go into the cuff. This is locked here, so make sure it's locked. If it's unlocked, if I put pressure, it's just going to deflate. So I want to make sure this is locked and leave this here. Next, what you're going to do is find the pulse using the Doppler. So with the Doppler here, you'll see when I turn it on, you should be able to hear a little something. There's going to be a volume button on the outside here. You want to probably turn this up as high as possible. That'll make it easier for you to hear the pulse. There's also a headphone jack. If you did want to use some type of headphones, you can, if there's a loud environment that you're in. So I'm going to put a little bit of ultrasound gel. There's two areas actually that you can use for finding limb occlusion pressure of the lower body. The first is the artery just behind the medial malleolus here, the ankle bone on the inside. So I want to come just behind this. This is the post-tib artery. The other one is the dorsalis pedis, which is going to be on the top of the foot. And this one will be usually in between the first and the second ray. So kind of go around here and you can feel this out. For Mike here, I'm going to use this post-tib artery, if I can find this. Okay, so I found it. I have a little bit of ultrasound gel on the tip of the Doppler here, and then once I have it, I'm just going to slide the Doppler head right there. With the Doppler, just so you guys can see, because the angle may be difficult, what I'm doing is coming in on just behind this medial malleolus here, and I'm going to feel for that artery. Then once I find it, I'm putting the head right onto it. And when you're holding the Doppler, you want to hold the Doppler at the head of the Doppler itself, not back here. This is going to be hard to stabilize. You want to keep it at the head itself. So if I'm here, I'm putting my hand on the ankle, so that way my hand stays stationary and I'm not slipping from that spot. So I'm finding it, and you guys can hear a little bit of something here. Okay, once I have that, I'm going to make sure my hand stays stable there, and I grab the gauge with the opposite hand. I want to make sure I'm on the right spot again. There it is. It's very faint, but if you pump it up, sometimes it actually increases. So I'm gonna pump it up just a little bit. There it is. And I'm gonna start pumping until I don't hear the pulse anymore. And pump very slowly. That's key. With the Doppler head, you don't want to push too hard to where you completely cut off the pulse. We don't want to push too light where you'll slip. So find a good firm pressure there. So I still hear it. I'm at about 120. I'm going to keep pumping. Starting to go down a bit. I'm at 150. So 160 there, and it's gone. So I'm going to slowly come off just to see where that pulse comes back. There it is. 159, I hear it. So I'm going to say the limb occlusion pressure is at 160. That's the minimum amount of pressure needed to completely occlude the arterial flow. And you want to make sure that you're on the right spot. So as you deflate this, so as you slowly deflate this, you should make sure that the pulse comes back. What I would do is make sure that you do this while you're on that spot. That makes sure that you're on the right spot. So what happens is if you're deflating this and you have your pressure on the pulse, and you're deflating and you don't feel like the pulse is coming back, you probably slipped. But you want to make sure that the pulse comes back when you deflate. That'll ensure that you're on the right spot and your limb occlusion pressure is accurate. That's how to get limb occlusion pressure of the lower extremity. And when you deflate, make sure to deflate slow and you don't just deflate it all at once.